Hello, everyone. Welcome to the Dr. Thyroid podcast and the RFAMD podcast. I'm Philip James. I'm seated here with Andy Barker. Andy, welcome.
Thank you. Good to be here.
Andy's from Indianapolis, and he has a very interesting story to share today. He's talking about being diagnosed with thyroid cancer, and he no longer has thyroid cancer, and he still has his thyroid. It's been an interesting, I would say, journey for you about not only the discovery of your cancer, but the treatment and the different treatment options that doctors were advocating for you to have.
Absolutely.
So, Andy, let's backpedal a bit. Let's start all the way to the beginning. It's interesting story in the sense you go to the dermatologist with your wife, correct?
Yes, that's right.
And she's getting a treatment, and the doctor says we might as well give you a quick skin scan checkup.
That's right.
And then what happens?
Well, it was really, I had a spot on my leg that I had noticed that was becoming very angry, I'll say. I thought it was just a freckle that had gone a little rogue and looked like it had a little bit of a scab on it. Come to find out, when the dermatologist said, let's roll your pant leg up, take a look at it, her immediate reaction was, hey, we better get that off of there now. And she was very concerned immediately. And it was not something I was expected. I had just met my wife for one of her appointments that was very routine and just being proactive on her part. And it became the beginning of my journey on finding out that I had indeed had melanoma develop. And that's what led to some tests post surgery on that cancer removal that had identified the thyroid nodule.
Yeah, so back up a minute. So you go in for your skin cancer treatment. That's all good now? You got it taken care of?
Yes, sir. Yes.
But during the, you had like a PET scan, I guess?
Mm-hmm. Yeah, post surgery, they had removed the melanoma and also a part of my lymph node symptom or system, just to make sure that they had clear readings on that. And so they wanted to run a PET scan on the entire body, and so the results of that PET scan had shown that the melanoma was clear, which was fantastic, and we were very thankful for that. But number two, they had noticed a nodule, about a 1.5 at the time, that they said was probably nothing. Lots of people have them, but maybe go get a biopsy on that, and let's just kind of double check it. And so we followed that advice to go get a biopsy performed on it.
So you get the PET scan. It shows a 1.5 centimeter nodule on your thyroid. Then they're now telling you, let's go get a biopsy on this nodule. And it comes back malignant.
Mm-hmm. Yes.
You must feel like the most unlucky guy in the world at this point. First skin cancer. But
Yeah.
then very blessed that you got the skin cancer taken care of, but that gets followed up with, hey, by the way, you have thyroid cancer. What kind of biopsy was it? Did they know right away?
It took about a day. The medical industry these days, you get the report sometimes faster than the physician gets it. And so you learn to be a little careful in reading those and not jump to conclusions. But often the summaries are pretty easy to read and understand. So they had performed a fine needle biopsy on the thyroid. They had referred me, the same hospital network, of course, had referred me to an endocrinologist. And so they performed that. And within a day, I had the results back, and it had showed that indeed I had papillary cancer was found inside that nodule.
What was your reaction?
What's that?
What was your immediate reaction who told you have papillary thyroid cancer? Which doctor?
The endocrinologist.
And how was it presented to you?
Well, again, I had the test results delivered in the hospital network's portal, so I had read it. Emotionally, I was a little still on my heels, I'll say, from the melanoma. I'm not somebody who's thankfully struggled with health issues, and I turned 50 in 2024, and I felt like, wow, becoming 50, all of a sudden I've got all these things going on. But anyway, so I was a little overwhelmed with it. And it was round 2 now of cancer. I learned that the cancer, the C word, so to speak, gets pretty hyped. And so the endocrinologist had called me right away, after the results were posted. I would say same day or next day, saying, "Hey, I want to have a conversation with you."
Oh,
And
wow.
yeah,
So Tone, her or him,
he,
endocrinologist,
yeah,
he, was
yeah.
his tone, was it unsettling? Was it comforting? How would you describe it?
It was a little uncomforting, and there was a sense of urgency about it. And so
Okay.
that could just be the way I interpreted it, but at the time it was round 2 now of being told you've got cancer, and he had recommended I get in, and well, his immediate conclusion was, we found papillary cancer. It's in the nodule. We don't want it to get through the shell, so to speak, of the nodule, and you should immediately seek a surgeon and have your thyroid removed.
Okay.
And so
So you have
it
an
was.
endocrinologist advocating for surgery. Now, fast forward, you didn't get surgery, but um, what happened next? Where did you take it? So you went to the office. Endocrinologist is advocating for you to go get your thyroid removed.
Mm.
What happened in the next 24 hours?
I had a lot of questions, and my faith is very important to me, and I had been praying all along about, please point me in the right direction, Lord. Please open these doors and show me what steps you want me to take. And I've got my mother's a retired RN. Matter of fact, she's struggled with thyroid issues her whole life, and having imbalances in the thyroid. So it's something that she's pretty in tune with. And we had friends and family over the years that had thyroid issues, and a lot of them had followed doctor recommendations, traditional paths to get them removed. And I was becoming very skeptical of my advice that I was getting. It's not to badmouth the hospital network, but something felt wrong in their, hey, just go yank that out. I had just received a baseline uh, test results from all the major organs in the body. It was part of the post melanoma process with my primary doctor, and all the organs were showing very healthy, including the thyroid. So I had this tug of war going. You're telling me to yank this out, and so I started doing some research, and I started asking questions. I've got a long term holistic doctor who was very helpful to talk to me about, let's slow this down. Papillary cancer is not aggressive, and his opinion, and from the research I had done, and let's just slow this down. I'm not comfortable, letting you jump off the board here and just rush to surgery. So that I started researching right away, having conversations with people that I trusted.
Man, how great, to look back, and I'm sure you're very grateful for your holistic doctor who said, let's just take a couple deep breaths and slow down.
Mm.
So important when getting a diagnosis of papillary thyroid cancer to understand it's probably been there for years, and 6 months isn't going to really change it.
Hmm.
There's no rush. I
Mm.
think it's important for those watching this interview or listening to do just what your holistic doctor recommended.
Mm. Yeah, you raise a really good point in this. Some of these things come back to memory now. It's been around over a year since all this played out, but that my holistic doctor made that comment. He says, the one thing that the medical system's not going to be able to tell you is, how long has that nodule been there. He said it could have been there 25 years. You didn't know it
Right.
was there until you took this PET scan. So that actually helped kind of eased me to think through, yeah, we've got time. I did go see the surgeon because I wanted to explore all avenues. And when I met with the surgeon, it was a really bad experience. The surgeon was distracted. He was taking a lot of phone calls in the middle of our appointment. My wife was with me, coming fresh off the heels of melanoma and that surgery, not knowing for sure we were clear yet on all the melanoma. There was a lot of emotions at play there, and it felt like he really wasn't in tune. When I asked him about any alternative to removing the thyroid completely, he really talked down to me. It really became one of those, are you an idiot? Why would you mess around with this? Let's get it out of there. Now, to his credit, one of the things he did say was, I think if you just got this out anytime in the next year, you'll be fine. You're not one of my urgent cases. This is not a urgent thing to do. So that helped me be more comfortable as well with slowing down the process and starting to seek out. But I was really doing a lot of research over what happens when you take your thyroid out. And I'm not someone who wants to take medicine. And so the idea of being on a lifelong pill just didn't sound real exciting to me. So
quick recap. Endocrinologists, well, first off, you go in for your skin cancer, which was totally surprise. You didn't think you went in with your wife. She gets her skin checked. You get yours. You have skin cancer. You have to have it removed. You get a PET scan. It shows a 1.5 centimeter thyroid nodule. Endocrinologist calls you up kind of in a dire tone. We need to talk. You have thyroid cancer. We need to get this out of you. Fortunately, you have a holistic medicine doctor who slows things down, puts the brakes on. But then you kind of have a good and a bad surgeon saying, bad meaning, let's take it out. Good being that he also pumped the brakes a bit and said, slow down for a minute. What happens next?
So I start searching out information on what happens when you remove your thyroid and what are there any alternatives. It just made sense to me. I use this expression, whether it's good or bad, but if I had a hangnail on my pinky, I'm not going to cut my hand off just because then I'll never have to worry about a hangnail again. That example just resonated with me. It's pretty simple, but I'm a simple guy. And so I thought there's got to be something else you can do to maybe chase this a little bit. At the same time, the society has pumped up the word cancer so big, and the medical system really acts like it's the end of the world. And in my research, I found out, hey, you've got your body's fighting off cancer cells every day. A healthy immune system is zapping those. And so thankfully, I had really wise people around me, and I started searching out different alternatives. And on my own research online, I had come across the RFAMD website and started watching some of the videos, started listening to some of the podcasts, and it just made sense to me. So then, of course, you say, well, why didn't my hospital tell me about that? And long story short, I come to find out they don't have any surgeons that are trained in that. They don't have anybody there. It's not a tool in their chest. And so I started searching out, well, is there anybody nearby that does this?
Do you remember the search terms you were putting in that resulted in you landing on RFAMD?
Well, I would say that I was searching out papillary cancer and the thyroid removal, alternatives. And I would say that website popped up at the top really quickly. It was definitely something that popped up quick.
So you were doing your own advocacy as a patient, seeking out your own information, which is so important. And I think for anyone who's been diagnosed with papillary thyroid cancer, it's so important to seek out the best information available, which you did. So you were doing kind of this discovery, exploring options. What was resonating with you, and where did it take you?
What resonated with me was the idea to go in after the nodule and actually take that out instead of removing an entire organ. And I started to think through that. Even if that doesn't work, that seems like a logical first step to try before we would jump to the conclusion of let's just yank out the whole organ. So I started doing more research about it. I went to the website. I researched the surgeons that are connected to the association. I found one that was close to us in Indianapolis.
When you say association, the ones that are on the RFAMD map.
That's true. Yes, that's right. Yeah, the RFAMD map. And because I wanted somebody that was well versed and trained, approved in that procedure, of course. And I started asking the holistic doctor and my primary doctor about ablation. And am I saying that correctly? Is it ablation or
That's right,
yeah,
ablation, thyroid
ablation?
ablation.
And so they had said that they had not heard of that procedure in thyroids, but that procedure was used in a lot of other medical needs and was something that was very common. So that also put me at ease to know that. And I had tried to reach out quite extensively over the course of a couple months, trying to reach out locally to the doctor that was on the website. And I could not even get a phone call with that doctor unless my current hospital network would transfer my test records and all the paperwork. And for whatever reason, I couldn't get that done. It was very difficult. You learn really quick how messed up the medical systems are when you start dealing with them in that way. But long story short, I grew weary, frustrated. I couldn't even get to this gentleman. So I went back to the RFAMD website and emailed the general email saying, hey, here's who I am. This is what I've got. I'm trying to reach so-and-so. And they were responsive through the website within 12 hours. I wake up the next morning and here's this email, and they had said, hey, given your circumstances, we recommend Dr. Kandil. And they had copied him in on the email in his office. And within 4 or 5 hours that day, I had communication from their office. So it was a very good first experience.
Yeah, you bring up a good point. The friction that we experience as patients, and I guess we could be country specific in the U.S., where it can create a lot of obstacles in getting the right care. So it's good to hear that you were able to find a solution that was responsive and gave you a resource that in fact treats thyroid cancer without surgery, that being Dr. Kandil. Mm-hmm. So now you've been introduced to Dr. Kandil's office. They're very responsive. What happens next?
Well, they talked me through, hey, let's get a phone call with Dr. Kandil. Can you get us a copy of your records, which I was able to do. I did have it was encouraging that not only the doctor in Indiana, but Dr. Kandil was associated with a well-known hospital, name. And so that added some credibility to a procedure that still felt like it was not widely known about, widely accepted. And so that added some credibility. The overall experience, his office was very responsive.
And you flew down to New Orleans.
That's correct. So he had looked at my records, called me and said, hey, we think you're a great candidate. Of course, we had a longer conversation about it. Give me the background, that sort of thing. Think you'd be a great candidate for this. Talked me through all of the ins and outs, things I would need to know. Not making any guarantees, just giving me the facts, and that put me at ease. And he said, yeah, let's get you on the calendar. And I flew down to New Orleans and to his medical center to have that procedure done in the fall. That was the fall of 2024. And it went great. It was, you felt very aware of what was going on. They talked you through everything. And I really understood what they were doing, why they were doing it. And it was a great experience.
Andy, let's fast forward really quick. You recently had a test to see what happened to that nodule. You want to update us all on what's going on?
Yeah. So we had a 3 month and then a 6 month check-in. And at the 6 month mark, we had seen a reduction, a continued reduction in the size of the nodule. It was actually down below a 1. And I'm told that if it's below a 1, they probably would have never looked at it in the first place. So that's quite interesting. Very successful result. It continues to shrink. But more importantly, Dr. Kandil said, let's go ahead and run a biopsy on it. He says, based on my experience, my thinking is we've probably killed off the cancer, but let's go ahead and do that. We'll have peace of mind. And so I had a biopsy performed locally. And those results were indeed there was no cancer left in that nodule.
Awesome.
So it's been completely
awesome. People hear that, and if they're approaching this being naive or not knowing that it's real. Ablation's not hocus pocus. That in fact, what you're describing, you were treated for thyroid cancer, 1.5 centimeter nodule, that your endocrinologist was advocating for surgery immediately, thyroidectomy. A surgeon in Indianapolis was telling you to get a surgery within a year. Fortunately, you had your holistic doctor who was putting the brakes on, but then you get treated, in fact, without surgery, preserving your thyroid with ablation, and now your biopsy shows no cancer.
That's right. Yes. It's such a
Great.
such an answer to prayer. I mean, the work that you guys are doing needs to be promoted. You'd be, I would be sitting here without a thyroid if I would have followed traditional standard care, as they say. And I'm thankful that we have the medical system we have in the United States, and I respect and admire the people that work in it. Unfortunately, sometimes the blinders are on, and there's a lot more going on there that prevents people from maybe grasping and looking at some alternate procedures. But I will tell you an interesting story. I had the biopsy performed at a different hospital network here in Indianapolis, and the gentleman that performed the biopsy did not have the history. So I was catching him up. And when I said I had had thyroid ablation, he was so excited, and he asked me for your information, and he wants to study that more. He's a big believer in the procedure, and he was not aware that they were doing that on thyroids. And so I'm really encouraged by that, that how this word's getting out there, because I could be sitting here today without a thyroid and taking a pill, and who knows what side effects from it.
Hopefully there's people listening that haven't had their thyroid removed, if they were being told to, or if they're told they have a thyroid disease that requires surgery. In so many cases, it could be treated with ablation. And I think we should really emphasize during this interview right now, though, that thyroid cancer being treated with thyroid ablation in the United States, Dr. Kandil is the top guy for doing that. He treats what you call complex cases with ablation, but you're going to find probably 90% of thyroid ablation doctors will not touch thyroid cancer with ablation because it requires a certain level of skill.
Wow.
So you definitely ended up, there's something watching out for you, it sounds like, in regard to your holistic doctor, and then doing your own advocacy online, and then ending up in the office of Dr. Kandil.
Yes, 100%. Yeah, that's been a great experience all around. And again, I am beyond grateful for the website and the work that you and others are doing to get the message out, because it's life-changing. And it's been a story that I've been able to share, obviously with the people in my life, and it gives them a lot of hope. We have friends that have had thyroids removed, who regret that. They look back, and it was different circumstances of why they had them removed, but just knowing that that wasn't necessarily the end all be all. And the thing I like about Dr. Kandil too was, he says, this isn't the only tool in the chest. He said, but we don't need to jump to conclusions and just, go right for organ removal when that's unnecessary. There may be a better way to do it. So.
Yeah. And you said, people who've had their thyroid removed that regret it, me included. I ended up with a bad surgeon who should not have done the surgery. And I regret it every morning when I have to reach for the meds and have a thyroid replacement hormone and other effects that it has on the body and the mind. That's why I do this and interview people like you. Hopefully we can get the word out there that there's alternatives where people can avoid surgery, even if they have thyroid cancer.
Yes, absolutely. And I'll say, what's that?
What would you tell other patients who are going through?
I would tell other patients that a couple of things. One, make sure you are your own advocate. In a post-COVID world, it's getting more and more difficult to cut through the noise. The medical system is. I've had some people share with me candidly that there's certain boundaries that they're not able to cross, and so you've got to be your own advocate, and you've got to search out alternative procedures, and then do your research. And this is a very safe, viable option. It is recognized. My understanding is by the FDA. My understanding is also that it's not being covered by insurance. We can draw our own conclusions, maybe why they're not covering that. In my case, I didn't let that be a barrier. I would say that don't let that be a barrier. Doctors like Dr. Kandil are making it available and doing the best they can to make that treatment and that procedure as cost effective as it can be for individuals like myself that are doing it outside of the traditional insurance path. But it is so worth doing it to maintain your quality of life. And I would definitely recommend it to anybody.
Man, you hit it right there. You said quality of life, 100%. When the thyroid is removed, it's going to change quality of life. And it's just great to hear that you were able to preserve your thyroid and get a biopsy result now that comes back and says you don't even have detectable cancer in that, what's remaining of that nodule.
Mm-hmm. Yeah. Yes, sir. Amen.
Hey, good job on being your own advocate. Great to hear that you took matters into your hands to a certain degree and found the best care available.
Yeah, I'm very thankful. Again, thankful for the work that's out there. I'm thankful for the ability to get connected with Dr. Kandil, and it's the association, the group that you guys have put together, and the information that you're getting out there is priceless.
Well, Andy, thank you. Thank you for sharing your story. For all of you listening or watching this interview, in the description to the interview, you're going to have a few links with some great resources. One is a link to a YouTube video with Dr. Miyauchi in Kobe, Japan, who says if you're diagnosed with papillary thyroid cancer, make sure you're aware of these things. It's like a 20-minute video. Be sure to watch it. And there's another one there that is with another patient of Dr. Kandil, with Vanessa, a patient who flew out from California, also had thyroid cancer, just like Andy, and no more. She got treated with thyroid ablation, and you'll find a link to that video. But Andy, thank you. Thank you for sharing your story.
Well, thank you for having me. And I hope and pray that it can help others to, maintain their quality of life and encourage them, and that there are alternatives rather than taking your entire thyroid out. There are definitely good alternatives, and this is clearly one of them.